Hi guys, I'm Lisa from Professional Development, and I want to show you how to make the lavender scented wipes that you'll be distributing to patients to help them sleep. The supplies that you need should be located somewhere on your unit, and you need to make sure that you make the wipes in a clean utility room where there'll be a sink available for you to get them wet and apply the lavender essential oil. In order to make the wipes, you need to actually have the bottle of essential oil. It's a glass bottle. And you're going to apply about 2 to 3 sprays of lavender essential oil to each wipe. There is a large refill bottle of lavender essential oil that will be kept somewhere on the unit, usually in the nurse manager office or a secure location. So if you do run out, let the nurses know and they can get you some more. You'll also need wipes. There are white wipes that should be available somewhere on the unit for you to make. They come in big packets. They kind of look like white napkins, and that's what you'll use. And then you also need some gloves, okay? The last thing you need is you need a basin, okay, and a sink. So first thing, put some gloves on, okay? So the essential oil can be pretty strong. The next thing you need to know is that the warming units for the wipes may not be in the clean utility room. They may be some other place on the unit, so make sure you know where it is. And around 6:30 or so, about 30 minutes before you prepare the wipes, you want to make sure you turn it on. It'll pre-warm the warming unit so that when you put the wipes in, they'll warm as quickly as possible. So I'm going to go ahead and turn it on, okay? Inside the warming unit are wire baskets. You can go ahead and take the wire baskets out and take them to the sink so that you can go ahead and make the wipes more easily and put the wipes into the wire basket to load into the warmer. So I'm just going to take one out. I'm going to set the wire basket near my sink, and I'm just going to go ahead and run some warm water into my wash basin. If the water's warm, it'll keep the wipes warmer and it'll let them warm up more quickly. So I'm just going to go ahead and take a big bunch of wipes and throw them into my water and let them generously soak up some water. Then I'm going to take about 2 wipes at a time, fold it in half, wring it out a little bit, and load my wire basket. You want to do this for as many patients as you have on the unit. So if you have 30 patients on your unit, you want to make 30 wipes. Okay, once you've made enough wipes for each patient, go ahead and take your lavender essential oil and spray about 2 or 3 times on each wipe. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, and so on until you have all the wipes sprayed. Then go ahead and take your wire basket full of wipes and put it back into the warmer. And once again, it takes about 30 minutes for them to get nice and warm. During this time, while you're waiting for your wipes to warm, you can go and interview each patient and offer them any of the other sleep aids that we have available. They're going to be on tent cards, and I have an example of one. Aha. So each patient in each patient room on the over-the-bed table, there'll be a tent card that kind of looks like this, and on the bottom of the tent card has all the different items that we have to offer. So we have eye masks, the lavender scented towels, of course, headphones, earplugs, warm blankets that you can get out of the blanket warmer on the unit, and then of course we have channel 3, which is on our Get Well network. It's our care channel, and it has a lot of relaxation and relaxing music and images that'll help them relax and help them fall asleep. If a patient should choose to request headphones, the actual headphones plug into the jack, which is on the call light. Here's an example of the patient's call light, and there's an actual jack on the side, so that's where the headphones actually plug in. So once you're done interviewing all the patients, any of the items that you need to give to the patients that aren't readily available to you may be locked up in the Pyxis on the unit. So let one of the nurses know that you need to obtain enough headphones, eye masks, and earplugs for all of the patients that you've asked so that they can get them out for you and you can distribute them. I suggest at this point, if you haven't already, get a cart because you'll need to have a lot of items with you and it'll be impossible to hold it all. So I do have a cart right here behind me. You can't see it in the video, but I do have a cart behind me. On the cart, you'll want to put an ice bucket and some tongs because this is what you're going to put the wipes in and distribute the wipes with, okay? So taking the wipes out, still have gloves on, okay? You're going to go ahead and put the wipes into the ice bucket, okay? They'll stay warm and they'll stay hot in the ice bucket. And then as you go into each patient room, you can go ahead and offer them the wipes out of the ice bucket in a nice, pleasant way. When they're done using the wipes, they can wash their hands, wash their face with the wipes. They're just disposable, so they can just go in the regular trash. Be sure that those don't go into the toilet. They can clog up our sewage system, so they really need to go into the trash. That's about it. If you have any further questions, please reach out to Julia or some of the other volunteers who I've trained in person. And I really thank you for helping our patients get better sleep. Thank you.